A Facebook page called The Doctor Is In. I'm Devin Walsh, and we are so happy to be joined by Dr. Brian Heller with the Southern Cancer Center. Is this the first time you've ever done a Facebook Live?
This is my first time on Facebook. Been on TV, but not on Facebook.
Okay, well, we're so glad to have you on Facebook, and we were glad to have you on WKRG just a few minutes ago. We know a lot of you are watching, and we're going to be waiting for that audience to build up on Facebook because we know many of you may have questions about cancer, cancer treatments, and we're going to be talking about a very promising therapy called Immunotherapy. It's something that a lot of people may have heard about. They don't really know what it is. So feel free right now, Facebook, go ahead and type in your questions, and then I will be checking the iPad, checking my phone, and asking Dr. Heller the questions you may have. All right, Dr. Heller, a lot of people might be thinking, okay, immunotherapy. That sounds like something out there that is difficult to understand. If you're talking to a fifth grader, which is what I want to try to do and explain this in layman's terms, what is this?
So our immune systems are very sophisticated in being able to scout through the body and recognize things that belong to us versus things that come from outside of us, like a bacteria or a virus. Well, actually, it naturally has the ability to also recognize cancer cells as not belonging there. But the cancer cells have a way around that. They can fool our immune system, and that's how they can start to grow. The main medicines that we use, that we are currently using, they simply, once we infuse it into the patient, give it to them IV, it allows their own immune cells to recognize cancer as being bad, and then our immune system is very good at getting rid of it.
Wow. So basically these drugs supercharge our own immune system.
Exactly. They allow it to do what it's naturally capable of doing. And the great part about it is it does it without a lot of side effects. In fact, the majority of people don't have any side effects.
That is amazing. So we talk about typically cancer treatment as radiation or chemo, but now you're adding this to the arsenal.
Absolutely. And chemotherapy, radiation, and now we have many new oral therapies. They're all still part of our arsenal. But as we have seen over the past year, immunotherapy, in particular these, what they're called checkpoint inhibitors, have become a mainstay of our treatment. We've treated thousands of patients at Southern Cancer Center throughout Mobile, but across the country, these drugs have become our #1 agents against cancer. And I think a lot of people don't realize that it's already out there.
Yeah, I think a lot of people don't. All right, so Dr. Heller, we're already getting some questions in. Is there a particular area of expertise that you have, or do you treat patients with all types of cancer?
I treat patients with all types of cancer. I do a fair amount of breast oncology, melanoma, lung, and colon.
Okay, so I believe we had a question about colon cancer. Does this therapy work on adenocarcinoma of the duodenum? Now, I think that's part of the colon. So you said, does this work on colon cancer?
So one of the interesting things about these drugs is that up until this year, no drug had ever been approved for cancers in general. It's always been drugs were approved for colon cancer or for lung cancer. These drugs have now been approved for any cancer that carries a specific mutation called microsatellite instability or a mismatch repair
So you
mutation.
test for that?
So you test for that. So if you have duodenal carcinoma, adenocarcinoma, your doctor tests for that and it comes back microsatellite unstable high, then you absolutely would benefit from this.
Okay, so if you are watching and you have any type of cancer, you want to be tested for that.
Absolutely.
Okay.
It is something that should be standardly tested for.
This is just a general question about leukemia. What are some of the early signs of leukemia?
So it used to be that patients would present with leukemia with bleeding, unexplained weight loss, high fevers. Honestly, nowadays, with general practitioners getting blood counts on almost everybody that comes in, usually the first thing we see is an elevated white blood cell count, and then their red blood cell count being low, so anemia, and then their platelets being low, which helps our blood to clot, and that's why people can get nosebleeds or bleeding gums. Now, I will say, bleeding gums and a nosebleed, 99.9% of the time is not leukemia. And people who have nosebleeds or bleeding gums from leukemia, it's profound. They usually have high fevers, weakness, weight loss, things like that.
Okay. All right, let's see. Now, this is an interesting question, actually. This is from Karen, and she wants to know, will this immunotherapy also help rheumatoid arthritis?
Well,
it has to have that satellite factor that you were talking about.
Yeah, unfortunately, it will not, because in and of itself, the immune therapy, rheumatoid arthritis is a disease where the immune system is attacking the joints. So these drugs can actually bring on a symptom like rheumatoid arthritis. So in rheumatoid arthritis, you want to do the opposite. You want to tone the immune system down. You want to calm it down.
Okay.
So this wouldn't be a good treatment for rheumatoid arthritis.
Okay. This person, this is another general question. Sherry wants to know, why is brain cancer seeming to be so common?
Well, we don't think it's any more prevalent than it was several years ago. Our imaging technology has gotten much better, so I think we're diagnosing it more than we had in the past.
Okay, all right. Let's see. This person, Amanda, says, I have a family history of cancer on her mom and her dad's side. At what age should I have any screening done other than a yearly female exam?
So most of that is based on the age at which her either parents or grandparents, whoever had the cancer, was diagnosed. In general, for instance, in colon cancer, you subtract 5 years from the age when they were diagnosed. So if your relative was diagnosed at the age of 45 with colon cancer, then you should start your screening colonoscopies at the age of 40.
Okay. All right. This is an interesting question. Hope wants to know, what about IV high-dose vitamin C for cancer?
So, we offer an array of treatments, and we've actually given high-dose IV vitamin C. There have been a plethora of studies looking at this. None of them have firmly shown that it helps kill cancer. Now, there are some studies that show that it can help with fatigue and other related symptoms. You have to be very careful when you do that. Vitamin C is an antioxidant, and radiation therapy and traditional chemotherapy operate on some level by forming superoxides that kill cells by interfering with DNA. The high-dose vitamin C can counteract that. So we do sometimes give high-dose vitamin C, but you cannot rely on it to kill the cancer. And you also have to be very, very careful if you're mixing it with traditional chemotherapy. Okay.
Let's see here. Will immunotherapy, this is Kathy wants to know, will it work on rare melanoma of the eye?
It's a very interesting question. I actually have a patient with that exact issue. And when you look at the data on immunotherapy, there are no studies saying that it works in melanoma of the eye because there are so few cases to look at.
Okay.
There's no reason to believe that it will not. The immunotherapy seems to work well in the brain because the brain and the eye are sort of walled off from the rest of the body. So we believe it will work. It's just we can't show a study. So I've chosen to treat patients with melanoma of the eye with these drugs. The first line of therapy for melanoma of the eye is either proton beam radiation, which is a special kind of radiation, or surgical removal. But if you failed those treatments, then I actually would try the immunotherapy.
So do you have to fail chemo and radiation to try immunotherapy, or do you just go ahead and throw it at the same time?
It depends on the disease. For instance, in melanoma and lung cancer, you can use it up front. Most of the other cancers, it's relegated to second line, so yes, you have to use chemo first. We do have some clinical trials at Southern Cancer Center where we're able to use it in first line. So whenever a drug's not approved for the first treatment yet, the only way to get the patients those drugs are to do it on a clinical trial. So we always try and get those trials here in Mobile so we can offer that to people in first line.
And that is huge. I mean, you want to go to a place where you are on the front line and offering these studies and getting people in them as quickly as possible, because a lot of these patients don't have time to waste.
Correct. In fact, I saw a patient just yesterday with a kidney cancer, and these drugs can work wonderfully, these checkpoint inhibitors in kidney cancer, but you can't use it till second line. So we went out and got a trial that allows us to use it in first line.
Oh, that's fantastic. Speaking of kidney cancer, Mary Bosarge says that she had kidney cancer surgery back in September, so just a few months ago. She says the cancer was on the outside of her kidney. They took half her kidney, and she did not need treatment because they got it all. Would this type of therapy help her now? I guess she's thinking to prevent a recurrence.
Right. So there's an oral drug that's been approved, so that we call that in the adjuvant setting. So the purpose of that is you're giving drugs after the cancer's been removed to keep it from coming back either in the same spot or somewhere else.
Okay.
Currently, the immunotherapy is not approved, but again, they're starting to have studies come out, and as soon as those studies are available, we're going to get those trials, because that is an area of preventive medicine that we're looking at, trying to keep cancers from coming back. But as of now, it's not approved yet in that area.
Oh boy, we're getting a lot of questions here, and it's such a variety of topics. Let's see here. So this person says, my husband has the BRCA2 gene. What should he be doing? He's 54.
So it's interesting in men. So BRCA1 and BRCA2 are breast cancer-related genes. Obviously, men can harbor them as well. He needs to be screened with colonoscopy. He needs prostate cancer screening. The biggest thing, though, is to have those related to him, especially if he has daughters, that they be tested for BRCA1 and BRCA2.
Okay, so even if they're at what age would you recommend? That's it's one of those tests you want to know that information, but it's people choose to make a lot of radical decisions based on the results.
Yeah, and it's very difficult when I counsel patients on at what point, if they test positive, that their loved ones should be tested, because it becomes very difficult with insurance decisions. Right now, there is an exception where you cannot withhold insurance from people for genetic reasons, but if the Affordable Care Act, Obamacare, were at some point repealed or changed, there's no guarantee that would stay in. So usually what I advise people, in particular if their children are younger, under the age of 18, or really I use that age of 26, I think, where they can stay on their parents' insurance, is to wait a couple more years and see where the federal law pans out. Because if that were ever taken away, it could be a big problem. If they had that mutation, insurance companies could then say, I'm not going to insure you. Wow.
Until you have your uterus and your breasts removed, or your ovaries, or okay, wow, that's a whole nother conversation.
Exactly. You're covered right now, is the way the law stands, though.
Let's see. Can an elderly patient with cancer take this therapy? Sharon Jackson wants to know that.
Oh, absolutely. Again, there's about a 10% rate of side effects, and when you have side effects, they're not like traditional chemotherapy, and that they don't produce nausea or vomiting. The kind of side effects they get are if your own immune system starts to attack, for instance, your lungs, you can get a dry cough, or your colon, you can get some diarrhea. But the vast majority of people don't have side effects. So we've given these drugs to people in their 80s and their 90s, and they tolerate it beautifully.
Okay. This person says, my mother has IgM deficiency from cancer treatments. Would immunotherapy be good for her?
This particular immunotherapy would not be, but there's a treatment where we give IVIG, so they're lacking that IgM is an immunoglobulin, and it helps us fight different infections.
Okay.
We can actually infuse people with that once a month. So if they're having recurrent infections because their IgM is low, we can put them on these monthly infusions and lessen that effect, so lessen their infections. This
buddy wants to know, does Southern Cancer Center have a board-certified urology oncologist on your staff, and with which hospitals are you affiliated? He says he needs to transfer his medical records associated with bladder cancer from Kirkland at UAB to a qualified physician in Mobile.
Well, we're all board certified in medical oncology, and some of us are dual board certified in medical oncology and hematology. A couple of us do a lot more urology. We have locations at all the hospitals here, so we have an office at Providence, an office at Spring Hill, Mobile Infirmary. We have a freestanding office in Daphne, and then we have another office at Foley at South Baldwin Hospital. So you can go to our website, Southern Cancer Center, and just click on the referral, and we will give you a call and get all that information. We'll get your records here, and we can get you seen within a week.
Okay, so could Buddy call and say, is there a doctor who sees a lot of patients who have bladder cancer? I mean,
absolutely.
You could recommend the right person. Let's see. This person, Melissa, wants to know, what should a 66-year-old female take over the counter to help with fatigue after chemo and radiation?
So there is a good medicine, American ginseng. There was a study that looked in particular at cancer patients who took American ginseng, 1 tablet twice a day.
Okay.
it was hard to find American ginseng before this study came out. Now you can get it at almost any health food store, and it has helped with fatigue associated with both cancer and chemotherapy. It wouldn't help everybody else.
Okay, can this be used for prostate cancer?
Again, it has not been specifically approved in prostate, but it is another disease where we would do that microsatellite instability test, and if it was positive, we could then use it. Yeah.
Okay. And this is just a broad question, but I know it's something that a lot of people worry about. She says, I've had cancer in this is Denise, her immediate family. Is there a test to detect cancer? I mean, that's such a broad question.
It is, and we get this question a lot. There are some tests out there that will just do a whole panel of tests. It's called a MyRisk profile. The problem with it is the vast majorities of mutations that we identify, we cannot act upon. For instance, I've had a patient who did this test, and they found that they were an increased risk for pancreatic cancer. We have no good way to screen for it. It told her that she has a 15% chance in her life of getting pancreatic cancer. Well, unfortunately, there's nothing we can do to prevent it. There's nothing we can do to screen for it, and she's left with that anxiety. And then again, it gets to the insurance question, because now that's part of the medical record. So I encourage people before they have a test like this to either see their primary care physician. We're always happy to sit down and talk to you, even if you don't have cancer, but we can talk to you about your risk and advise you whether or not you should have these tests done, and even get you into a genetic counselor to talk to them about it.
Okay, so you have genetic counselors there as well at Southern Cancer Center.
We don't have them on our staff, but we do the genetic counseling ourselves, physicians.
Okay, because a lot of people may want to do that, just to know what is my risk. Because I know that, I mean, I've even worried, I have cancer in my family, and I've wondered, I wonder if I'll, and what I've been told, the best thing to do, get your yearly, get your mammogram.
Absolutely, yeah.
Just get those basic tests. And
you know, mammograms, colonoscopies, seeing your physician once a year, those are the things we recommend. The fact of the matter is we have a lot of technology to detect genetic mutations, but that technology to detect those mutations is far behind our ability to do anything about them.
I see. Okay. All right, let's see here. And this is a bit of a broad question, but this Sharon Jackson wants to know, what is the success/cure rate with this therapy?
So it varies by disease, but I'll talk about we were involved in when these first came out in melanoma and lung cancer. So if you look at melanoma, because of drugs like this, 5 years ago, there was 5% of people diagnosed with metastatic melanoma were alive at the 5-year mark, just 5%.
So small.
Now with this immunotherapy, it's over 50% of people are still alive. And those people that are still alive at the 5-year mark are cured of their disease.
And that's almost like a miracle treatment.
Absolutely.
I mean, that's incredible. Okay, so if someone is going to, let's say, a cancer doctor in our area, and they aren't even, this is even on their radar, then they need to go somewhere else. I mean, it sounds like this is the direction that treatment is heading. It's the frontier.
This is not what we're doing a year from now. This is what we're doing now. What we're doing now is to expand where we can use it through the trials we're doing, and then we're looking for other ways to integrate it with chemotherapy and to develop new ways to harness the immune system.
Okay, let's see. This person just wants to know, Monica wants to know, she says her brother was diagnosed with prostate cancer at the age of 16 back in 1992. That is just so young. How many cases do you all see of young kids getting prostate cancer?
That is extremely rare. That is a case where I would look into genetics. Unfortunately, across the board with cancers, we're seeing children I should say young adults diagnosed earlier and earlier. We don't know, again, if it's just we're detecting it better, so they're getting detected at 18 versus 22, but that would be a very unusual case.
Does this work on, and you, I believe you've addressed this a little bit, but Denise wants to know, does this help once stage 4 is diagnosed?
It absolutely does, and in fact, that is the area that we use it the most. And when I mentioned those melanoma patients, those are in patients with stage 4 disease that was virtually a death sentence before. It doesn't work, you know, across other diseases, it doesn't work as high as 50, 60%. In some diseases, 30, 40%. The amazing thing is when it does work,
wow,
it works amazingly well with very little side effects.
And this person's asking about the, Tamara wants to know about the long-term good things about immunotherapy. Do we know yet about, I guess, the long-term effects of immunotherapy?
Well, at this point, when we have people on it, we have been leaving them on it indefinitely, but we're learning now that after about a year and a half or 2 years, we can stop it.
Okay.
And then the immune system goes back to reset it to normal. So there does not appear to be at this time any long-term effects. We've been using it at Southern Cancer Center for probably 3 or 4 years now, because before it was on the market, we had clinical trials and we had patients on it. So we have a lot of experience, and we have seen no long-term effects from it. Now, some patients, you know, we talked about rheumatoid arthritis. There's about 1 to 5% of patients can develop an inflammatory arthritis from it that can continue after you stop the medicine.
Okay.
But again, those rates are very small.
Okay. And this person, well, it's not about cancer, but she just has a medical question. So, Caitlin, if you're watching, she has ringing in her ears. It's Sunday. What causes it, and how can she treat it?
Well, I'd have to ask my ENT colleagues, but most of the time with ringing in the ears, it's some type of congestion or problem with the inner ear, so trying a decongestant. If you're older and you have high blood pressure, sometimes if your pressure's high, you can get ringing in the ears as well.
Okay. All right. Let's see here. We pretty much, we're getting a lot of compliments on here. They love Dr. Heller, and they said they appreciate how you always listen to their questions and just, you know, and really take a lot of time. And I'm sure that's a lot of what you do is you have to have a lot of patience, because people come in and they have a million questions.
Absolutely. And I want to again say hello and thank you to my patients. And I always tell them, I try and always run on time, and I tell my patients, I'm always running late, and I apologize, but I tell them I'm going to sit in this chair until all your questions are answered, and that's going to put me behind. But as long as you forgive me for that, I'm going to sit here until you're done, because there's certain discussions that I have to have as a cancer doctor that can't be rushed. That
cannot. That's exactly. This is Michael Albrecht is asking, and this is just back to what we just talked about insurance exclusions. He says, are those general genetic tests marketed on TV putting you at risk for insurance exclusions?
Well, there are certain ones that you can get commercially. I believe one of them is called 23andMe. If you go that route and it's not part of your medical record, so you don't do it through the medical establishment, you should be able to keep that private. It shouldn't affect your insurance. Even when you have it done through a physician, so your medical record, you're protected right now by the Affordable Care Act, saying that they cannot exclude you from a pre-existing condition.
Right.
If that ever changed, then anything in your medical record could affect your ability to be insured. Now, could the government or insurance agents try and get the information from companies like 23andMe? They should not be able to do that.
Right. And this is just a general cancer question. April Marie wants to know I don't know if you'll have the percentage, but she wants to know what percentage of cancer is linked, at least in some way, either directly or indirectly, linked to the consumption of meat or dairy.
Well, we don't have they've looked at it mostly in colon cancer, in particular red meat, and we don't have a direct link between the two. There's been some suggestions, so I can't say here today that any cancer is directly linked to your amount of red meat or dairy intake.
Okay, what about sugar? Does cutting out sugar help reduce the risk of cancer?
So I'm actually glad that question came up. It is all over the internet that if you eat sugar, it feeds your cancer. And you know what? It does. Every cell in our body uses sugar.
Oh, okay.
But that's the problem. You can't cut off sugar from your body. In fact, when you eat something, your body turns it to glucose. Your brain needs glucose. Every cell does. So it's true. If you starve a cancer cell of sugar, it'll die, but so will your normal cells. If you starve a cancer cell of oxygen, it'll die. But you'll also starve yourself of oxygen. So there is no advantage to cutting sugar out of your diet as far as your cancer goes.
Okay, that is so interesting, because you're right. Even yesterday I was reading someone who was writing about that.
Right.
So if you cut down on sugar, does it lessen your chances of getting cancer?
There's no evidence of that. And if it does, it is not because you're taking in less sugar. It could be, now one possible explanation could be as you eat sugar, it causes your insulin levels to go up, and there's these insulin growth factors that your body makes that could make a cancer grow.
Okay.
None of that has been proven, though.
Okay. And this person, you've addressed this, Clay Tyler, why would a doctor choose to use immunotherapy instead of chemo or radiation?
Well, again, it depends on the disease, but we would look at the patient, we would look at the cancer, and then in some cases we would say, well, I think this cancer will respond better than immunotherapy, or the patient I don't think could tolerate the chemotherapy, and then sometimes we'll combine them. But it has to do with the tumor type, tests that we do on the tumor, and then how well we think the patient is going to tolerate either chemotherapy, immunotherapy, or a mixture.
So it's just a case-by-case basis.
Absolutely. It's said so often about cancer medicine that every patient is different and every cancer is different.
And of course, you're taking new patients if people are watching and want to come see you. And where is your office located? I know you mentioned 3 different offices for Southern Cancer Center.
Right. So Southern Cancer Center, we're located at Providence Hospital, Spring Hill Hospital, Mobile Infirmary. We have a freestanding office in Daphne that also has radiation oncology in it, and then an office at South Baldwin Hospital.
Okay.
I'm at the Providence and Mobile Infirmary office. I've got the greatest set of partners I could ask for, and I can assure you they're all at the cutting edge of what we do.
Well, Dr. Heller, thank you so much for taking time and answering questions today. And for those of you watching and you want to follow up with Dr. Heller, just give them a call, and he won't rush through your appointment. He'll
Absolutely
answer your questions. Thanks so much. We appreciate it.
Thank you very much.
All right, everybody, have a good afternoon.